Oh, hi there. I am going live now.
Okay, great.
If everyone is joining, we're just getting going. So we're so happy you could join us. And we're going to officially start in a little bit. So we're just so happy you could come on this lovely morning. Well, welcome everyone. This is so exciting. I'm Dr. Felice Gersh, your integrative OBGYN, and I'm so excited. I have a brand new program going, and we're going to talk all about bones and how to have healthy bones so you don't break bones, because I can tell you, I have had relatives, so many, that have had fractures, including like my mom, my dad, my aunt, two aunts. I mean, I could go on. And I bet every one of you out there has had relatives, maybe even yourself, who've suffered life changing, and they can be life ending fractures. So, Mark, I'm going to invite you on to introduce yourself, and then we're going to get started.
All right. Well, thank you, Dr. Gersh, for having me on. I really appreciate it. It's always exciting to talk to you. I'm Mark Charbonneau, for people who don't know me. I'm a scientist by training. My background is in microbiome research, actually. And I've been working in the pharmaceutical industry and in biotechnology for about 10 years. And currently, I'm the vice president of research and development for a company called Bio. And we recently launched a new medical food symbiotic product for maintaining bone mass. And I'm excited to share some of the information about that, how it can be a new option for people who are trying to preserve the bone that they have when they're young.
Well, such an important topic. That's why we're here. So let's start at the beginning. For people who maybe haven't gotten a science background, bio background, what exactly is a bone? What's it? What is a bone? People think of the skeleton hanging in the closet, right? So maybe you can help people. What is bone anyway?
Yeah, you're right. I think people often think about bone as the back of the science classroom hanging up on the rack. Well, what's interesting about bone is that it's not just an inner scaffold that holds your body together. It's actually a living tissue, like all of the rest of your organs in your body. And so, yes, it does have that hard mineral, but inside of that, there are cells that are actively working to keep that bone strong. There are cells that build up that new bone, and there are cells that break it down. And that's a process that's always ongoing throughout our lives to try to keep that bone as structurally strong and healthy as it can be, and to prevent you from breaking.
Yeah, that is such an important topic, that bone is living, right? And that bone is dynamic. I know in my medical world, we talk about bone turnover, and that involves different cells that build and cells that break down. But the thing that we want to prevent at all costs, if possible, is this condition called osteoporosis. So maybe you can explain what exactly is osteoporosis, and then we'll get into how to prevent it.
Yeah, absolutely. So as we age, typically we lose bone mass over time. And osteoporosis refers to a condition where your bone mass is decreased to the point that it's not as structurally strong as it used to be. And it puts you at risk for fractures. And, what we really are concerned about are fractures that can happen from ordinary daily things. So like if you're young and you're healthy and you say you slip and you fall over, typically you wouldn't break a bone. But if you're someone who has osteoporosis, those sorts of daily normal things are more likely to cause a break. And that can have a lot of problems, could cause a lot of problems down the line. It's not just broken bones, it can have huge impacts on people's quality of life and independence. And so we really want to try to avoid that however we can.
Now, I was talking to a friend of mine who is a trauma surgeon, and I said, what's the most common cause of trauma that you see? Is it, accidents, industrial kind of injuries, or car accidents? And you know what the answer was? Falls. It's like, oh my goodness, falls is life changing. Yeah, falls. And one of the things that's interesting when you think about the word osteo, which means bone, porosis, it's like it's open. So I think of the pictures I've seen where you have this dense bone, and then you have bone that looks like it's all full of holes, like Swiss cheese bone. So how does this come to happen? Like maybe you could talk a little bit about what are some of the underlying features like that could cause osteoporosis.
Yeah, absolutely. So what it really comes down to is balance of the processes that are happening in our bodies. So Bones always, I'm not sure how many people know this, but when you look at the inside of a bone structurally, towards the ends of the bone, where you think of like where your knee is, it looks like a network. Like you have a mesh of that bone in there. And those connections, they form a scaffold that holds your bone together. And when you have osteoporosis, those holes get bigger and bigger and bigger, and that's not a good thing. But the progression of bone biology follows a normal pattern in most people, where we build up our bone very rapidly during adolescence and early adulthood. And then usually about the time we're 30, we reach peak bone mass. And we don't really need to build up any more then, we're good. But what happens for most people is a gradual process where we lose bone mass year over year for most of our lives after that point. And for women in particular, when they go through the menopause transition and there's a big drop in estrogen levels, that accelerates and you have a faster drop off of bone mass. And the reason that's happening is because those two processes, the bone buildup, which is done by cells called osteoblasts, and the bone breakdown, which is done by cells called osteoclasts, those are not balanced anymore. And you start having greater and greater breakdown, it outpaces the buildup. And so while your bones are trying to remodel themselves to stay strong, what ends up happening is you lose that bone mass more over a longer period of time, and that can lead to that fragility that people experience when they have osteoporosis.
Yeah, it's so common that I see patients, they come in, they've had their first DEXA scan, and they already have significant bone loss, that we call the first stage osteopenia. And maybe you could talk a little bit about the difference between osteopenia. Is there a difference between that and osteoporosis? And they're so shocked though. It's like, how could this happen? Like they wonder, like I don't know. I thought I was doing things right. I took calcium. Was that enough? So maybe you can explain a little bit about what is the mechanism of this bone loss?
Yeah, so there's definitely a lot of information there that I think is helpful for people to understand. The first is this word of osteopenia, and that might be a scary thing if someone gets that diagnosis. Osteopenia and osteoporosis are related. They both pertain to how much bone mass you have. And so typically what doctors are doing is just defining cutoffs as you lose bone mass. Once you get to a certain threshold of bone loss, defined by something called a T-score, which is from your bone mass, once you get to a certain level, they say you have osteopenia, which is sort of low bone mass. And then once that gets even more extreme and you have an even lower T-score, at some point you are then categorized as osteoporosis. But really, it's a spectrum. It's a continuum of bone mass. And it's not really, we really shouldn't be thinking about it as a 0 or a 1. Either I have this or I don't. Everybody has bones, I hope, and everybody has some amount of bone mass. And the less bone you have, the higher your risk of fracture is over the long run. So really, it's not about do I have this or not. It's about how can I maintain as much of my bone as possible while I'm young and as I age, so that I can reduce those risks. And then for people who have osteoporosis, then we want to think about building that bone back up. I actually want to ask you a question, Dr.
Oh, okay.
Sort of your experience. Since I'm coming at this from a scientific research perspective, and I'm really interested when I talk to physicians who are seeing people who are, getting bone scans, especially women in menopause who are starting to see, I have osteopenia. What are the sort of reactions that you're seeing from patients, and what are they looking for in terms of how they manage their own bone health and the solutions that are out there right now?
Well, I find a panic. It's really a state of panic when they see that they have low bone mass, because like I mentioned earlier, almost everyone knows someone who suffered a fracture. And it happens in younger women. Like when I say younger, I mean like around 50, so, like we have different fractures at different times of life. In the younger, like 50-year-olds, they tend to fall forward. So they break their wrist. So we call that a Colles fracture because they have the balance enough that they fall forward instead of backwards and they land on their hands. I've had patients where they broke both of their wrists at the same time. They come in wearing 2 casts. It's like one on each arm. And then when they get older, they tend to have less balance and they fall backwards and to the side. And that's when they get those really most life-changing fractures, which are the hip fractures where they're breaking their femur, or the pelvic fractures. They're incredibly painful. And often more of the rib fractures, they fall and they break their ribs, and the pain is excruciating. You can't immobilize, you can't put a cast on your pelvis or on your ribs. And so you keep breathing, you keep having to move and wiggle. And so it's just really, really a painful situation. And my patients know people in their family and friends and relatives who've had these problems. So they're really in a state of concern. And so they really want to know, okay, what can I do now? And this is such a critical question because they need it answered. So in my practice, I take what I call a layered approach. I'm very into lifestyle. To me, lifestyle medicine is medicine. I don't know why that's not universally, incorporated into every medical practice. So I'm going to look at, well, how is your sleep? We know so much is going on when you're sleeping. And, are you smoking? Unfortunately, in my practice in California, I have very few smokers, but smoking is still out there. So are you smoking? How about alcohol consumption? Now it's been deemed zero amount is the best amount, but at least moderation, right? Don't go too much into drinking alcohol. And then, I look at stress, emotions, and stress bring out your cortisol, and they can have bone effects as well. And then we get into nutrition because what you eat is really important for your bones. I want to talk about that because I learned a lot. I learned so much from talking with you before and learning about the gut microbiome. So I do get into that. I'm going to let you get into that. And so I talk about nutrition and how that can impact bones, the whole food is medicine reality check, and fitness, exercise, doing resistance training, things to put a little counter pressure on the bones. Like a lot of people spend most of their day in a sitting position and then all night in a lying position. None of that is doing a whole lot for their bones. So, we want to look at all of that. And then I'm a big hormone advocate. Now it's really becoming much more in the news that, and you touched on this, that bone is lost in a process and it starts early in the menopausal transition. By the time you get to that official definition of menopause, which is so arbitrary, 12 consecutive months without any bleeding, that's late in the game. That's late in this process of ovarian senescence or aging and changing in the hormones. So now I start hormones on my patients and I discuss this during the perimenopausal years, as I call it, like a topper, top it off. I call it supplementation to try to give them a safety net so that at least they can't fall below a certain level. And I explain how estradiol and progesterone work, calming down the osteoclast and, encouraging the osteoblasts to make more bones. And then, I talked about they get a DEXA scan. So I'm a big believer in you need to measure if you're going to monitor. So, I encourage early aged start of doing monitoring. Like, why are we waiting till a crazy age like 65 when you can do so much less? Prevention is the name of the game when it comes to bone. It's so much better and more, more successful to work on bone loss prevention than when you have end stage disease osteoporosis. And that's just reality. But that brings in the whole world of pharmaceuticals. There is a place for pharmaceuticals in certain patients. Like maybe they need one of the peptides that encourage bone growth. Maybe they need to include a bisphosphonate, like Reclast, a shot. So there is a place in selected patients for pharmaceuticals. That is typically a far down the road kind of a thing because there's so much we can do that doesn't involve pharmaceuticals in the state of prevention when we're in that kind of a world. But getting back, because I'm such a big advocate for nutrition, and that links into that like new, very trendy, but appropriately so, topic of the gut microbiome. I pictured this spider web where the gut microbiome, and I have like rays, like a sun ray, and it links to everything. Could you explain if there's a connection, what the connection is between the famous gut microbiome and bones?
Yeah, absolutely. I think that the gut microbiome is probably something people have heard about, but they don't necessarily understand what it is or how it influences things. And I think that makes sense. So what the gut microbiome is, it's a community of really trillions of microorganisms, mostly bacteria, and live in and on our bodies. And here we're mostly concerned with the microbiome that's in our gut because it's what interacts with our food, it interacts with our immune systems, and it plays a major role in so many different aspects of our health. And what we've learned is that bone is one of those. And like you alluded to, it's not necessarily obvious because when you think about the gut and you think about bone, they don't touch each other. So it wouldn't be obvious that they would somehow
I hope not.
they do. And so some of this research that's been really exciting and really illuminating about this comes from studies in animals. And so, for really decades, we've been studying menopause and how that influences bone loss using animal models where you can surgically induce menopause in mice. And then just like in humans, they will rapidly lose bone. And so we use that as a model for understanding what's happening in the biology of those animals. And what was really interesting about this, and for me was kind of shocking to learn, so there are mouse models where you essentially raise the mice in a bubble, like bubble boy. So they don't have any microbiome at all, no microbiome and on their skin or their guts at all. And you can do the same thing. You can induce that menopause. And what happens is, if you do that in mice that don't have a microbiome, they don't lose bone.
Wow.
And so what that tells us is that the microbiome is playing a major role in what's happening with how menopause and that decrease in estrogen is influencing bone loss. They're part of that chain. And what we've learned in the years since then is that connection, what drives that connection is the immune system. Microbes in the gut can influence the immune system, they can influence inflammation throughout the body, and then that in turn can have effects on bone, because as you have more inflammation in your body, that increases the activity of those osteoblast cells that break down bone and can accelerate that process over time. Which really leads us to the question of, okay, well, if that's what's happening, can we use the gut microbiome as a lever to bring that inflammation down, to control that inflammation and to slow that bone loss down so that we can do what you said, which is really act early and preserve the bone that we have before we get to a point of needing bisphosphonates or other pharmaceuticals.
Wow, that is like a whole new way of thinking about bone, I'll tell you. And in terms of the gut, okay, so there are trillions of these microbes. And then when you have the wrong ones, we call it dysbiosis, like dys as abnormal, bio as in life form, you have the wrong ones. There's this gut barrier that's involved in this process. Maybe you could touch on so what is the role of the gut barrier in terms of creating systemic, like body-wide inflammation?
Yeah, one of the major roles that the lining of our gut plays is to protect our bodies from those trillions of microbes. So they can do lots of good things for us, but they can also do bad things. They can cause disease, they can cause inflammation, and so our gut serves as a sort of a firewall that keeps those bacteria where they're supposed to be inside of our gut. But what can happen is that if you have inflammation or you have other disease states that predispose you to this, that firewall can start to break down, and there are gaps in it. And you can have, for example, molecules or components of these bacteria that are inflammatory and make it across the gut barrier into the rest of your body, and that can cause inflammation. And so one of the things that we want to do is try to keep that barrier strong and tight so that we sort of protect our body from those inflammatory signals.
And if that gut barrier becomes like dysfunctional, like breaks down, and then these bacteria cross between the lining cells into the body itself. I know we talk about leaky gut all the time. Everyone's heard that, thank goodness. It used to be like laughed at and sneered at, the term like leaky gut, and now it's like so accepted. And then the immune cells become like, we'll say, annoyed and alarmed, like alarm bells go off. Maybe you could touch on what are these immune cells actually getting upset about, and what are they doing?
Yeah, well, what they're getting upset about is they're seeing molecules that are from bacteria. And so our bodies have evolved and our immune systems have evolved. When we see bacteria, that's bad. You want to get rid of that. And so what inflammation is a response to that. We need to have inflammation. We need to have our immune systems. They do a very important job for us, protecting us from infection and from controlling disease. But it can get out of hand. And if you have inflammation in the context where you shouldn't, that can lead to some of these problems like the increased bone loss. And so the way that immune cells talk to each other is through signaling molecules. And cytokines are a type of that signaling molecule that they can make. Oftentimes they're proteins. They can produce them. They move. Those signals move through the body, and they tell other cells what to do. And that can either amp up the inflammation or it can bring it down depending on what your immune cells are doing and what kind of cytokines they're making. And so if you have this gut leakiness and you have these molecules or signals that are coming from bacteria that say, oh, there's bacteria here, this is not good, then your immune cells will make more of those inflammatory cytokines, and that can move throughout your body, including to the cells of the bone. We talked about osteoblasts and osteoclasts, and those derive from immune cells. So they can respond to those same signals, and their activity then will increase as a function of seeing those inflammatory signals in the body.
Yeah, it's such a fascinating thing. The way I often explain it to patients, when you have immune cells, they're like our guardians, they're our protectors. And they're there to try the first responders, the innate immune cells that make these inflammatory cytokines. They're like the first responders to, like, they say attack, attack, go into attack mode. And when you have the leaky gut, when you have the impaired gut barrier and you have these microbes, these bacteria coming through between the lining cells into the body proper, I say it's like having a chronic infection, because these are inappropriately placed bacteria in your body. They should be in the gut lumen. Like, get back in there. It's like having a chronic infection, and the immune cells respond in kind. They start, like acting like you have an infection, and they produce those cytokines. But it's so fascinating that the immune cells, these osteoclasts that are embedded in the bone for a totally different purpose, for, helping to clear the old bone, the dead bone, suddenly they become activated. Just go into a little bit more about this fascinating process, how this systemic sort of low-level inflammation with the cytokines circulating, like rev up these osteoclasts that are embedded in the bone to do their thing inappropriately. So people kind of get an understanding of how this like strange gut bone axis is really triggering bone loss really seriously.
Yeah, it's really an important component of why we lose bone as we age. We often think about the accelerated bone loss that happens in menopause and the drop in estrogen being responsible for the effects on bone, and that is true. But one of the reasons that estrogen has that effect is because without, at least in women, as that estrogen drops significantly, you have greater systemic inflammation, and that signals to osteoclasts to start breaking down more bone over time. In fact, this happens in both men and women. Some of the mechanisms are a little bit different, but sorry, my dog is. As we age, everybody has more systemic inflammation that happens throughout our body. Our cells get older, including our immune cells. They start having more of those inflammatory signals that are innate. That's true for both men and for women as we age. And so people, everyone, bone mass will tend to decrease over time. Even in men who don't go through menopause, you do have that bone loss that happens. And it's much more common than I think people realize. You mentioned earlier that screening for most people for bone mass starts happening at age 65. That's because that recommendation is optimized around diagnosing osteoporosis. They're not thinking about osteopenia. So by the time you get to age 65, 80% of women already have either osteopenia or osteoporosis. So I agree with you that we're starting way too late, and we need to be thinking earlier about when those processes are starting to happen and what we can do through nutrition and lifestyle to help preserve that function and keep those cells in balance.
I try to do analogies so people can sort of understand the processes. So I sometimes think about bone like I think about someone's finances, like for retirement. So during certain years of our life, we earn money and say we put it in a savings account. So that's like we want to build bone and put it in our bone savings account. And those years are the bone building years, which go from like puberty through the 20s. And then my understanding is that you've pretty much reached your peak bone mass when you hit about 30. So from there, it's all about wealth preservation. Now you have to see how you're going to spend it so that you save enough money to get through your whole life, without going into destitution. And then you want to check your finances and you look and you have like $2,000 in your savings account. Uh-oh, that's supposed to last you for the rest of your life. Well, there's two possibilities. You never saved, so you never built your savings account, like building bone. Maybe there were diseases like celiac absorption, maybe there wasn't like your bad choices, it was life circumstances. But now you have to look, did you maybe didn't earn enough money, you didn't build enough bone, or you're losing it. So that's where we have to monitor, if necessary, we can get lab testing, we can do bone density. So we see, okay, where are you at now? And then how did you get to that point? Did you not build enough bone? Did you lose bone? Are you actively losing bone? Because we know from that point on, if you can't earn more money, once you hit a certain age, it's really hard to build more bone, right? So we have to make sure we preserve that bone. And it seems like it's inevitable that as we age, we're going to lose some bone. Like, we can't like never lose bone, but the thing is to lose very little, to build as much as we can during the bone building years. That's why we have to think about osteoporosis and bone health when we're young. Don't just start thinking about it when you're 65 and you're told you have osteoporosis. This thinking process should begin really, really early in life. And the sooner we know and take stock of our finances, the better off we'll be. So that's why testing a bone density earlier, like I usually try to start at the onset of menopause, like by age 50. But if they have earlier, because menopause is considered normal at 45. So we got to really think younger. And you mentioned it's a process, so it's not like you cross the finish line. So in terms of like fracture risk, is there much difference between osteopenia and osteoporosis?
In terms of lifetime fracture risk, actually no. So one thing I was shocked to learn is because osteopenia is so common, 54% of all hip fractures in women occur in women who have osteopenia, not those who have osteoporosis. And that's because osteopenia is so common. And when you look at the lifetime fracture risk, it is a little bit lower for people with osteopenia, but it's still much, much higher than somebody who has healthy bone density. Right. So I think it just reinforces that point that it's not a 0 or 1, do you have osteoporosis or not. It's a matter of how much bone mass do you have and how much can you maintain to keep that risk as low as you possibly can.
So in terms of the product that your company is making, could you talk a little bit about, well, what's the mechanism with that product and why should people know about it?
Yeah, absolutely. So what we've done at Slurry Bio is developed a new product called Bondia. It's a symbiotic medical food that really fits in with that layered approach that you were talking about earlier, and specifically in the nutrition side, which is how can we take advantage of the ways the gut microbiome interacts with bone, that gut-bone axis, to reduce that inflammation and preserve as much of that bone as possible. And what we found is that, so Bondia has 4 different probiotics in it. They're all derived from fresh fruits and vegetables, and they're specifically formulated to produce those anti-inflammatory compounds in a synergistic way. So it's like, I like to say that all of our probiotics are superheroes, but together, Bondia is the Avengers, because they work better together and they keep that inflammation low. And by doing that, it can help in 3 connected ways. So number 1, we've shown that it can improve gut barrier function. So that leakiness we talked about, it can help keep that low. It can reduce the production of those inflammatory signals by immune cells. And then ultimately, what it does is it reduces the activity of those osteoclast cells to help preserve that bone for as long as possible. So we just published a randomized placebo-controlled trial where we enrolled 286 women who were all within 6 years of the onset of menopause and gave them Bondia for 1 year. What we found is that in the groups of women who were most at risk, so including those with osteopenia, in those women, taking Bondia reduced bone loss in the hip by about 85% compared to women who were on the placebo. Similarly, we also saw strong benefits in women who had high BMI and those with elevated body fat. And this makes sense because those are conditions that are associated with that greater systemic inflammation. And so that's how Bondia is working to help reduce that inflammation and preserve that bone as we age.
Well, I think that is so fascinating. Can somebody just go to the store and buy any probiotic product, or what's special about yours?
Yeah, so it's really important. Not all probiotics are created equal. We often, I think, culturally, we think about probiotics. Probiotics. That's really not the case. There are hundreds or maybe thousands of different species of bacteria that live within our bodies. They change over time and they do different things. So the strains in Bondia are specifically formulated to work together to make those anti-inflammatory compounds in the gut. And we have the clinical evidence that really shows that benefit, especially in women who have osteopenia. Other probiotic products, it varies. Some have different levels of evidence than others. Very few probiotic products that exist on the shelves have good, solid clinical evidence showing benefit for them. And the other thing is that you don't always get what's on the label. So a study that was published a few years ago showed that they looked at 11 different probiotic products and found that of those 11, only 2 had the concentration of probiotics that were stated on the label. The other side is
no.
much as 99% less than what was stated on the label. But Bondia is cool. We ship it cold to keep the probiotics alive, to keep them viable, so that when it gets to you, when you take that product, you're getting the high concentration that you need to have that benefit and really that anti-inflammatory effect.
Wow, this seems like such a major breakthrough in science to really understand, those trillions of microbes. They're doing good things and some are doing bad things. And you were able to, through really scientific exploration and study, to find the specific strains that really can work to help to lower bone loss. Because if we're all going to age, we're all going to have some bone loss. To slow it down is like that. It's so exciting. So what would they do if they wanted to get your product? Is it something that they should ask their doctor for a prescription, or is it, like considered more like a supplement, medical food?
Yeah, so we get this question all the time. So Bondia is categorized as a medical food, which is a category maybe a lot of people are not familiar with, but it lives in a space between supplements and pharmaceutical drugs, which means that it's not a supplement in the sense that we have done clinical studies to demonstrate the benefits and the mechanism by which it can preserve bone loss. But it's also not a drug, which means you don't need a prescription to get it. You can buy it directly. Now, because it's a medical food, we do recommend that you work with your physician and that it's used under their guidance to make sure that it's part of your holistic bone health and wellness plan, but it's something that can be just directly purchased.
That's great. And if you buy it, is there a way to use, say, health savings accounts? Because it's not a prescription drug. So is there a mechanism, since it's medically indicated, that they can use it as part of their health savings account and such?
Yes, so it is eligible for HSA and FSA, and so that can be used to help offset the cost and really make it as accessible as possible.
Well, that's fantastic. So what's in the future? If you think that there's some interesting questions that you're still working on answering, like what are you involved with research, and what's burning in your head, like to kind of keep going here with this bone kind of exploration?
Yeah, that's why I have to go off about science. I think it's exciting. But there's a lot. I mean, I think part of it is understanding how inflammation, and certainly is a foundational to how bone changes over time. But it's really important for many aging-associated chronic diseases. And so I think what's top of mind for us is how can we reduce inflammation to improve many aspects of aging and improve our overall wellness and lifespan, our health span rather. But in addition to that, when we think about bone specifically, the medical landscape is changing pretty rapidly. One of the big ways it's changing is around the popularity of GLP-1 medications. In a recent survey that was done in 2024 found that 14% of respondents have taken or are currently on a GLP-1 medication. And so we know when you lose a large amount of your body weight, you also lose bone. And so it raises this question of what impact is that having on people's bone density, on its strength, and on ultimate fracture risk. And so one of the things we have our eye on is how can opportunities like or options like Bondia help to preserve bone as people are, working on improving their body composition? How does that relate to, say, individual compounds? Some of these GLP-1s are associated with greater fracture risk or osteoporosis risk than others. And we want to see how can we kind of incorporate that into overall wellness as this sort of paradigm of how we age and how we manage our bodies is changing.
Wow, I hadn't even thought about that. Everyone talks about muscle loss with the GLP-1s. They never talk. I never hear anyone talk about, well, does it have an impact on bone? That's so fascinating, because we know that they're very teamed up, those bones and muscles. So I can't wait to see the future research. And if there's, for everyone who's listening, to give one, like you would say, the most important, if you're going to forget everything, but you're going to remember one thing, like the biggest takeaway, this is it, the big light bulb went off.
Yeah, I mean, I think that if I was going to say one thing is you don't have to wait till you have a diagnosis of osteopenia or osteoporosis to act and to protect your bones. The earlier you work on it, the more you have to protect. I'm not a menopausal woman, as you might imagine, but I'm on Bondia to help preserve my own bone mass. It also has benefits for gut health, that helps me out a lot too. But the earlier you act, the more you can preserve your bone, and the better off you'll be as you age, and hopefully the better outcomes you'll have.
Well, I think that is the best advice that I have heard today. And I really am so thrilled and so grateful that you could join me, Mark, on my first ever Instagram interview live. So, and everyone who stuck with us and helped us, it's been a great time spent with you, and I've learned a lot myself, and I hope you'll come back.
I will definitely come back, and thank you for inviting me. And I'm honored to be your inaugural Instagram Live attendee.
Yes. Well, till next time, everyone, have a great day.
All right, thank you.
Bye.